So now I come to the topic, that is patients' expectations from cancer therapy. So let me ask all of you, if your near and dear ones were diagnosed with cancer, what would be your topmost priority? And as oncologists or as doctors, we assume that this is the best chance of cure, right? We think every patient wants the best chance of cure, and that is logical, that is rational. But is it a fact? So to understand this, let me start with how do we give treatment options to our patients? And since this is a lung cancer conference, I have taken the example of lung cancer. Earlier, non-small cell lung cancer was clubbed into one disease. Then we divided that into adeno and squamous. And now, based on driver mutations, we are able to divide them into a large number of subsets, each one getting a different line of treatment. But whether you take chemotherapy, whether you take immunotherapy, whether you take targeted therapy, whether you take PD-L1 directed therapy, what is the outcome? And the top right-hand survival graph represents the outcome comparison between systemic chemotherapy, targeted therapy, immuno-oncology monotherapy and immuno-oncology combination therapy. So now when the best chance of cure or survival as shown on this graph is almost identical between the various treatment options that we have, how do we decide or how do we counsel the patient in relation to what the patient expects out of treatment? Another example from breast cancer. If you have a patient who is high risk, hormone receptor positive, HER2 negative, early breast cancer, I have a choice between ribociclib versus abemaciclib. And the difference is not the survival or the outcome. The difference is the toxicity. In one instance, there will be more neutropenia and hepatotoxicity. And in the other instance, there is more diarrhea and thrombocytopenia. So we need to take these factors into consideration when deciding what is the most appropriate treatment based on patient's expectations. If you have a lawyer and who has vocal cord cancer, we cannot do surgery. Organ preservation is vital, okay? Because his life earning depends on that. And if you have a model who is going to walk the ramp, we can't do colostomy, right? Yeah, then her whole life will be ruined. So patients' expectations are very, very vital. Now this is not a new subject, okay? This has been a subject of great interest. A couple of months ago, I did a PubMed search and patients' expectations from treatment had more than 1.9 lakh hits. And this is a well-studied subject as well. There are 46 systematic literature searches, including more than 10,000 patients. So we did a survey and we asked patients, what is your first preference from treatment? And the best chance of cure was selected only by 46%. Less than half the patients were focusing on best chance of cure. 30% wanted longest possible survival, but the other quarter are really important, where they want minimal visits to the hospital or least number of side effects. So Anupa showed in one of her slide the non-oncology survival expected in the patient, but she did not have the time to explain to you this, so I am going to explain. And I have taken the example of my family, okay? That photograph is my family, and I am one of the few privileged to have 4 generations alive and well living together at the same time. And for this example, again, I have taken my example because I am 65 years old. I was born in 1958, so that time my life expectancy was 68 years. Today I am 65 years old. So now my life expectancy has increased to 83.8 years. And supposing I am alive for another 10 years, my life expectancy will increase to 87 years. This part of conditional survival is not really appreciated when we talk about how to manage patients and what sort of goals the patient will have out of treatment. So this is a WhatsApp group that we have of doctors who have had cancer in their near and dear ones. And you can see that we have 244 members. And this is the sort of experience and emotions that us doctors, us oncologists are having about a near and dear one who is having cancer. So we again decided to ask them, what are your preferences? And this is how we are using the slider which is seen on your right side. So the first preference cannot be more than one. If somebody else, there is a tendency that everything is my first preference. So on this slider, there is only one at each option that is available. And this survey included 188 patients. The subset of 95 doctors where age of the patient was specified, I am going to show it to you today. And we are comparing the expectations between older patients with cancer and younger, as well as what is their first priority, whether it's cure versus quality of life versus longest overall survival. So older patients with cancer were 70%, that is 66, where it was either a parent or a close relative or friend. And younger patients with cancer were 29, that is 30%, where it was either a sibling or a child or another close relative or friend. And irrespective of age, the people who wanted cure as the first preference was almost identical in both. It was 73% for the older patients and 76% for cure. So as doctors, we still want cure as the outcome even in our older patients with cancer. Now, is there a financial reason why we select this? So we decided to say, divide the answers between those where the responders were bearing the expense of the cancer treatment versus responders not bearing the expense of the cancer treatment. And naively, I was expecting that the wish for cure would be more for younger patients. But actually, it's the other way around. And this is food for thought. It could reflect our society where we want to show to society, family, relatives and friends that we are looking well after our parents and we are doing the most that we can do for our parents. But this is something that was unexpected, and I think this is what we need to do further evaluation on. So with that, I thank you very much for a patient hearing and will be happy to answer any questions if there are. Anupa, over to you.
Thank you, sir, for such a wonderful talk. So I just had a couple of doubts, that's all. First of all, I mean, if we ask very blankly, from your experience, how difficult has it been? I mean, this, when we say and see, it seems a bit straightforward, but how difficult is it to, ask them about the expectations and, to, first of all, to ask about all that, and secondly, has it been possible to actually meet the expectations of the patients?
So the second question is very easy to answer, and the answer is no. It is not often that we meet their expectations. And the reason why we don't meet their expectations is because we don't ask them. If we don't know what they want out of treatment, then how can we, deliver the goods? And I'll take the example of a pediatric patient. Let's say that is a 8-year-old boy with acute lymphatic leukemia. He comes to Tata Hospital. Parents are bringing him. He is walking. He has a little fever and he has little fatigue. But he is walking. We do the investigations and tell him, oh, this is an emergency. Your child is going to die soon unless we start the treatment immediately. We start the chemotherapy, and at the end of 3 weeks or 2 weeks, we do the bone marrow, peripheral blood. There are no blasts left, bone marrow is recovering fine. And we tell the parents that the treatment has worked, your child is fine. The parents are not in that state of mind because they have seen that the child who had come walking with little fever is now vomiting, is not eating food, he has lost weight, he is not able to sit up. So this is the difference between what we look at it as oncologists or doctors and what the patient, family or caregivers look at it. And I think the reason why I wanted to make the presentation is that we have to first understand that we have to ask the question. If we ask the question, then we will be probably able to meet their expectations.
True, sir, true. So it's really important to ask the patients about, what is their expectation, what do they know about what is going on with them, and how, and what is their expectation in the next 4 or 5 years, and if they know the diagnosis properly, and are they actually understanding what is actually going on with them. So all this is very important, as sir rightly pointed out. So now we will move on to the